The chairman of the National Association of Resident Doctors, Obafemi Awolowo Teaching Hospital OAU Ile-Ife chapter, Dr. Ibukun Enese, brought to national and international attention the grievances of the hospital's medical staff. The hospital, once renowned for its patient care, is now facing a crisis due to unpalatable welfare conditions that have demotivated doctors and healthcare workers. Dr. Enese outlined several critical issues affecting the staff, including a severe shortage of doctors and clinical staff. The last employment drive in 2022 remains incomplete, exacerbating the stress on existing medical personnel. This shortage has led to increased waiting times for patients. Dr. Enese demanded the immediate completion of the 2022 employment process and the release of waivers for the 2023 and 2024 employment of clinical staff. Additionally, the resident doctors have not been paid for 14 months, with around 45 doctors still awaiting their March 2024 arrears. Despite engaging the hospital management through formal and informal channels, only 3 months of the 17-month salary arrears have been paid. Dr. Enese called for the immediate payment of all salary arrears and the unconditional payment of the March salaries for the 45 members unjustly removed from the payroll. Laborers deserve their wages, he stated emphatically.
We are out to protest various critical welfare challenges that is telling on our health, on our well-being, and also on our ability to attend to patients. And basically, we have had an issue that we have been at for a long time, especially about 42 doctors who were employed as far back as in 2022, in some early 2023, and their employment was just declared null and void, just suddenly. These our doctors did not employ themselves. They did not do anything. They were just called to pick up appointment letter. They picked up appointment letter. They followed all the guidelines stated. They even did the medical test, and they were employed. They were given letters of introduction, and only for them to now be termed, in quotes, illegal suddenly, and then their salaries, they will not have any legal claim to it. Out of 14 months, we have barely been able to get maybe even 3 months salary. And then we have been asking, where is this salary? Where are we going to get the remaining salary? Even if you revalidated the process and you brought in new employment letter with new dates. So where are we going to get the 14 months that we work for? The laborer is desirous of his own wages. You understand? So that has pushed us to the brim. In the same vein, some people's March salary were suddenly stopped, and with no official communication to them, no written communication, it was just stopped. And so we're asking, these people worked, if they are illegal, are the services they render to the hospital also illegal? So where is the money, the money for the services they have rendered, the health challenges they have faced, the risk they have faced, the risks they have faced all this while? And so where is their money? Where is their compensation? Where is their wages? And so those are some of the things that has pushed us to this brim. And despite the fact that we have interacted with the management and also with the even higher up, we are not getting any assurances. We are not getting anything to go with. These people are still being termed illegal. These people are still being denied their pay. We don't know when exactly the pay is going to happen. And we are getting a lot of instruction or feelers from high up that it seems policies are coming that are so inimical to service delivery in OHAC. And so we just feel it's better we bring it out to the public, so that at least let the public adjudicate this case.
The deplorable working conditions were also highlighted, with core rooms in disrepair, lacking basic amenities such as water and electricity. Despite repeated notifications, the management has taken no action to address these issues. Furthermore, call meals for doctors on call were stopped 2 months ago. The resident doctors demand the restoration of these meals and the renovation of call rooms to acceptable standards. Another critical demand is the immediate payment of appointment allowances, which have been settled in other centers across the country, but not at OAU. The implementation of the no work, no pay policy following a 5-day protest for the non-payment of 40 months of arrears was also condemned. Dr. Enese called on well-meaning Nigerians, traditional rulers, and President Bola Tinubu to intervene and press the hospital management to address these issues to prevent a disruption of activities at the hospital. The resident doctors have given the hospital management a 4-week ultimatum to fulfill these demands, failing which industrial action may ensue.
Deplorable working condition. The state of the call rooms in the hospital is bad. Some of these call rooms are leaking and lack basic amenities like water and electricity. This has also been brought to the attention of the hospital management, with no effort as resolving the issues. To add to these welfare issues, the management unilaterally stopped call meets for our doctors on call since 2 months ago. We call for immediate restoration of befitting call rooms for call meals for our members and renovation of the call rooms to acceptable standard. Immediate payment of accoutrement allowance. We want to use this medium to express our displeasure at the attitude of the management to the accoutrement allowance that has been paid in some centers in the country. The posture of the hospital management to the payment of this allowance is not reassuring, as various formal and informal discussions are showing a grandstanding position. We call for immediate payment of this allowance to all cadres. Reversal of the draconian no work, no pay. We observe with dismay the speed with which the hospital management implemented the draconian policy of the no work, no pay for the 5 days of protests of the association for the non-payment of 14-month arrears of our members. A management that holds its members 14 months arrears salary was quick to deduct 5 days salary for protesting. We know this is an attempt to gag the association. We want to assure the management that we are not deterred. We demand for the immediate reversal of this policy and payment of the 5 days deduction. We want to call on all well-meaning Nigerians, traditional rulers, and the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, to impress on OHAC management to do the needful to avert disruption of services in OHAC. We are also, by this release, giving the hospital management a 4-week ultimatum to address these issues. Failure to do so may result in industrial harmony between our members and the hospital management. Thank you, and God bless you.
Dr. Taiwo Olagbe from the Department of Medical Pathology also voiced his grievances, highlighting the physical, mental, financial, emotional, intellectual, and spiritual toll these issues have taken on the healthcare workers.
Today is not a good day. And what we are seeing, what you can see here, is a fallout of the mismanagement and some of the wrong policies that are inimical to us, and we are saying no to them. Now, one of those things, let me quickly stated them to you. One, we have some of our members who have worked over 14 months, and up to today, their salaries have not been paid, and they have been sardonically termed illegal workers. As if that one will not be enough, some of our members are removed, suspended from high peace on excuses that are not tenable. And as a result of that, they've lost much salary. And up to this moment, these salaries have not been paid. As if that one will not be enough, suddenly they call food, who is even a kind of a solace to the member that are working their house out. Because as you can see, there are shortage of manpower. We have a situation whereby only one person is doing the work of 20 doctors. But still, this heart of demonic repression that have been meted out to us, our call food has been stopped with no clear clarification, with no message. And for over 4 months, no call food. When you look around the environment, you see that butchers are everywhere. The environment are not suitable to be called an health institution, the health institution. When you go to the call rooms, they are in deplorable states. It's an eyesore. Go to the Elisha, the West League. It's terrible, it's not palatable, and it's not even good for even a dog to stay there, not to talk of the doctors. As a result of this, our sanity has been tampered with. Now we brought this to the knowledge of the management. The management, rather than solving this problem or show an empathy and demonstrate responsible leadership, has resorted into threatening. They have resorted into try to divide us. In fact, one of the high personnel of the management even said that, do we know that the federal government can kill? And they, as a representative of federal government, were asking them, are you threatening us? As if what you are even doing are not killing us. Our life is in danger. And so we have reached a breach that we can no longer tolerate it. And we try to make a protest. We try to make a protest for just 5 days, in which even some few days out of these 5 days are weekend days. And what we will get as a response is to deduct our money. You can't beat a child and expect a child not to cry at the same time. So the management is flogging us and expecting us to cry. And so we are shouting to people outside there that can help our cause and solve this problem. Thank you.
Professor Josephine Ezei, chairman of the Medical Advisory Committee, speaking on behalf of Chief Medical Director of the hospital, Professor John Okeniyi, appealed to the protesting doctors. While acknowledging the concerns raised, she assured them that efforts are being made to address these issues promptly. She therefore urged the doctors to exercise patience as the management worked towards a resolution.
A lot of things had gone wrong. We are trying to put things back in perspective. That the ALD should exercise patience for this management to make things right and be able to rectify some of the things that have gone wrong. We have said it. We have said this on and on again. But I will say it again, that the hospital is committed to the members of staff. We are interested in the welfare of the member of staff. We found ourselves at this point because of past mismanagement, and we are trying to make sure that things are done as it should be. Kindly give us time. Believe in us that we are interested, just as we want the staff to be happy. We also want patients to be happy. Don't let us use these issues to prevent our patient from having the good services that we have always been providing. We have always been an institution who has given its best to our patients and to our environment. Let us keep this good name. Let us be in the news for good things that we are usually known for, not things that can be easily solved when two parties come to the table. We know that core meals is an incentive. It is not a statutory. But we are calling you to round table to understand with us that we are interested in your welfare. Concerning concerning the core rooms, I must say that I have been the one that have been calling the ALD to let us see how to sort out the core room, especially the casualty core room. And I've just spoken and discussed with the head of accident and emergency 2 days ago, on Friday, that we will sort out some of those things so that people can be happy staying on call, because the casualty is the high of the hospital and we need to do something about it. Things have been done. Presently, we've gotten over 200 and something bed sheets that we just gotten is in my office, and I'd even also shown it to the ARD president to give me, let us come together. How do we go step by step in sorting out this column? So all these things that they have brought to the fore of the press are actually things that we have been working on together, that we have